everyone, and welcome to the EMDR Maven podcast. I'm Julie Miller. I'm a licensed professional counselor and an independent addiction counselor. I'm an EMDRIA-approved basic and advanced EMDR trainer, an EMDR Institute regional trainer, and an EMDRIA-approved consultant and certified therapist. I provide basic and advanced training through the EMDR Development Center. You can learn more about that at the website emdrdevelopment.com. This is season 2 of the EMDR Maven podcast. We're going to be discussing the use of EMDR therapy in the treatment of addictions, both substance and process addictions. And you can develop confidence with this population as you listen to the podcast, attend trainings, including my own trainings on the EMDR Development website. I'll be happy to discuss any of your questions here on the podcast. We'll also have some other EMDR consultants who specialize in this area talking about their work. On the website, there are free courses and free trainings that you might find helpful. I host an EMDR no-fee study group on the last Wednesday of each month, except for December, from 12 noon to 12:50 p.m. Arizona time. This group is for anyone who's completed the EMDR basic training, and we can talk about addictions there as well. So send me an email, and I'll be glad to send you the link to the Zoom room that we use for that consultation group. Again, you can contact me at jmiller4721@gmail.com. So send me an email with any questions you have, or if you'd like the link to the no-fee study group on that last Wednesday of the month. jmiller4721@gmail.com. This is episode 5 of season 2 of the EMDR Maven podcast. We're going to be continuing our conversation with Susan Brown, who joins us to talk about EMDR and addiction. Susan, as you may remember from the last episode, number 4, is a seasoned psychotherapist with over 35 years in private practice in San Diego, California. She specializes in the treatment of complex developmental trauma, addictions, and other maladaptive coping patterns. Her clinical approach integrates internal family systems-informed processes with the EMDR therapy standard protocol. These integrated approaches reflect her commitment to nuanced, client-centered care. Susan served as principal investigator in a pioneering pilot study that applied an EMDR integrated trauma treatment program within an adult drug court setting. She co-authored multiple book chapters and scholarly articles and is widely recognized for expertise in working with complex trauma populations. She's a sought-after educator and presents nationally on the integration of EMDR and IFS, offering specialty workshops and advanced trainings. She's been a regular presenter at the EMDRIA International Conference, including plenary sessions and full-day pre-conference institutes. In addition to her clinical work, she's an EMDRIA-approved consultant and facilitator for EMDR basic training, mentoring clinicians in the application of EMDR with complex clients. So let's welcome Susan for part 2 of our conversation. So are there any myths that come to mind about addiction in particular, but also maybe the use of EMDR with addiction clients that you want to take this opportunity to dispel?
That's a really good question, too, because I've been doing this clinical stuff for 40 years, and many evolutions have come in that time. So it's really hard to say what's myth, what's fact, what's truth, what's not when it comes to the human brain and the human capacity. Very difficult to say. For example, a myth is that I want to say it that addictions are incurable. I don't like that word particularly, but because there's so much brain function involved, and let's say genetic vulnerability or generational vulnerability, there's so much we don't know about the way that addiction came to be. There's a lot we do know, but I think there's still a lot we don't know as far as what the brain is capable of healing.
Mm-hmm.
So there's, I think, quite a few myths that you're not supposed to, they still exist, that you're not supposed to do any intensive trauma work with folks who either have no sobriety left yet, but they're committed to sobriety, or anybody early in sobriety. So, do you remember trainer Gerald Puck?
Yes.
Jerry Puck is one of the earliest and most gifted trainers that I had the luxury of working with as a facilitator. And he was asked this question like 30 years ago, which is, can we do EMDR with clients who are not yet sober? And his answer to that question was absolutely, positively, maybe. And that's really the answer as far as I'm concerned.
Yeah, that's
Hasn't
funny.
changed much.
Yeah.
Yeah,
Yeah. Well, that might have been before the addiction focus protocols. Was that before AJ did the detour?
I don't think so.
No.
No, they were pals.
Ah, okay.
They knew each other well, and
Yeah.
I believe Detour was alive and well in those days.
Ah,
So, do you
yeah.
do you hear myths that you
Oh,
now know to be untrue?
absolutely. That's one of the big ones, which
Okay.
is the thing about not doing EMDR too early. And in fact, when I first got into the mental health field, my goal had been to be an addiction counselor. I wanted to work in the addiction field. And in no part related to my own personal research on addictions. I had nothing to do with it, of course. But I immediately learned from my colleagues when I was doing an intern at a residential treatment facility that we don't do trauma work or EMDR. They didn't even have anybody who did EMDR back then. With somebody who's brand new in treatment and they're brand new sober. They have to be sober for a year before you can do any trauma work. And I suspected that was inaccurate. But then once I got my EMDR training, I knew that it was, you know, complete junk. That it's absurd to do that. In fact, especially with the addiction focused protocols we have, we can help people stabilize the addiction so that then they can be in treatment, really in treatment, and then get to the trauma work faster. But to expect someone to have a year or even 30 days of sobriety without having some kind of work done on these
Right.
earlier experiences is it's just sad, it's just sad to believe that that could actually work for someone to keep them sober but not dealing with what they were using over to begin with.
Yes, precisely. But I think that's because the whole myth thing is linked to another myth, which is that EMDR is phases 3 through 6. It's the eye movement part and
Right.
the processing part, not phases 1 and 2. 7 and 8, of course, are after the fact, but
Mm-hmm.
no, it's that EMDR was seen as just those processing phases,
Mm-hmm.
but not the history and assessment and preparation and stuff like that.
Yes.
So the parts work to me, in especially in phase 2. Phase 1 is you're getting to assess the system. Phase 2, as you are getting permission to do anything you're going to do,
Right.
essential. And
Yes.
that is not part of the EMDR protocol.
It is if you conceptualize phase two as doing that. I mean, that is
Yes.
preparation, right?
All right.
So
And
if you
that's the
conceptualize
integration.
that,
Right.
yes, then you definitely can see, because I learned really early in my career in treatment programs, residential especially, that even if I'm only doing phase two, it's
Yeah.
still EMDR. And very often
100%.
that was all we could do. We only had them for a short time. That was all we could do.
Yes. And still true. I
Yeah.
just don't remember getting permission as being a focus of attention with standard protocol, but I think it's really critical, and especially with these
Yes.
cases, because of the blowback if you don't have it.
Yes.
Great.
Definitely. That's something that is missing from the trainings is we don't talk about that kind of thing in basic training, at least in the basic trainings that I've been doing. So I think that is an important thing to include is that sort of assessment of where the person is. Are there any obvious um, red flags, but also how can we get all the different parts that an individual has, the multiplicity of the person on
Right.
board with doing this work?
Right. I guess with all due respect, EMDR basic training is basic.
Yes.
Parts work is advanced. Addiction
Mm-hmm.
work is advanced. So
Mm-hmm.
just to be clear, you have
Yes,
to
that's true.
learn that
That's true.
basic
It
first.
can be overwhelming.
A fire hose. That was my recollection.
Well, I don't even remember. I can remember the face of the person that I was in the dyad with doing the processing in the practicum.
Yeah.
And I do remember there was a facilitator there basically would stop by, tell us what we'd been doing wrong and get us started again in the right direction. But I remember next to nothing of my basic training. I don't know how I learned to do it. I showed up and then fortunately I kept getting training.
Yeah.
So somehow it stuck. But yeah, I remember little from basic training.
Funny. I do remember basic training. I don't know why. It's very memorable on many levels.
Yes. Do you remember who your basic trainers were?
Yes. Barbara Parrott was
Oh,
one. And Andrew Leeds. Thank you.
yeah, he was with
I
the
don't, I'm
Institute.
blocking on that name.
Yeah. Now, let me ask you this. I know that the Congress decided that, well, others did too, but Congress decided that addiction is a disease. Way back in the 90s, it might have been, I can't recall.
Yeah.
Decided that addiction is a disease. And there is some, I think, controversy about that,
Mhm.
in that disease is reflected in the DSM, in that you have an addiction forever and always. It just may be in sustained remission, but it doesn't matter if you've been sober a year or 25 years. If you've been labeled with that diagnosis, you are still going to have that diagnosis. It's just going to be sustained remission. And I think that's part of the disease concept,
It's a
that it
medical
doesn't
model.
go away.
It's a medical model.
Yeah. And I argue with that. I don't think that it's a disease. I think that's an improvement over what people used to think it was, which was a moral failure, a weakness, a lapse. You know,
Yeah.
it made you so much less of a good person. But I really like something that I heard from Johann Hari. I don't know if you heard. Yeah.
Yeah,
I
sure.
think he's the one who said this, which is that the brain isn't diseased, it's plastic. So it doesn't have to stay in the form that it is now, in the function it is now.
Right.
And that's really flies in the face of it being a disease. So what do you think about that whole disease model thing?
I've been talking about that one for a long time.
Hmm.
If you want to call it a disease, then you'll have to separate the letters,
Hmm.
and it is a form of dis-ease. There is great uneasiness in it.
Hmm.
And I totally am a neuroplasticity person. And that's what I mean about I can't say what's a myth and what's not because we're still infants
Hmm.
in neuroscience as far as I'm concerned.
Hmm.
So we don't know what the ultimate capacity of the brain is to change, heal, and alter itself.
Hmm.
The other thing is, I have seen, and I know you have too, that allergy makes more sense to me. That there are people who are allergic to a substance. So they can go 20 years, pick up a drink, and be right back where they started. But I feel into that more as an inability to process that. So if you want to call that a disease, I suppose if it's medical model, it helps the pharmaceutical industry. but I don't think it's the whole story by any means. You're right. It's a far cry from it's a moral failing.
Mhm. Yeah.
And so, um, I think there are medical aspects to it, and there are medical assists that can help people get free of this,
Hmm.
but never bought into the whole thing as a disease.
Mm.
Well, it's an oversimplification of a really
Yes.
complicated issue.
Yeah. And also, I think it comes from the effort of those affected by someone else's addiction or
Mm,
alcohol problems is a way to label it, and then maybe we can control it. So I
mm,
think that, where it came from in Congress was actually Joe Biden, whose
mm.
son
Yeah,
is an addict.
yeah.
And so I
The,
could kind of see some codependence, like wanting to control it. And if I can make sense of it, maybe we can control the addiction. So I think there's elements of that in this as well.
the stigma that goes with this topic
Hmm.
is profound.
Hmm.
So, for example, what you just said, which we are very used to saying about Joe Biden's son being an addict, he's not an addict.
No?
He's a person
Oh, thank you.
who
Yes.
has a problem with substances. He is a person with a problem,
Yes.
this particular problem.
Yes.
So much of the languaging is so ancient, like somebody's test's dirty and
Yes.
they need to be clean.
Hmm.
Try not to use that language,
Yes.
or if possible.
That's really helpful. I think that's important for everybody to hear, and for me too. Because I say I say it differently when someone has borderline personality. I don't say they're a borderline,
Right.
but with addiction, I do say they're an addict, they're an alcoholic, or whatever. And you're right. I think it's disrespectful and limiting and continues to perpetuate the stigma.
Totally. Right.
Thank
And
you.
that's
Thank you. I'll clean up my language.
well, it's hard because it's been decades
Yes,
of the languaging being used that way.
right.
You can't fault us for these habits, but it's on us to catch up
Yes,
and
I
be
like
more.
that. Would you say something? I've heard you talk about this. Would you say something about addiction as an attachment disorder? And I mean, that's just so ripe for IFS or other kinds of parts work.
Wow, you just want me to say something, huh? Hmm.
Well, a couple words.
I was just thinking that of all the different presentations I've done, workshops I've done, the one that's missing is that one.
Really?
I'm working on it. Yeah,
Okay, good.
it's a whole subject unto itself
Hmm.
that you can speak to a little bit when you're teaching, but I think it deserves more than that.
Mm.
And okay, let's just take IFS for example. One of the precepts of IFS is that it is attachment taken inside between self and a part, and that self is so organically healing to us, ourselves, to our parts, that other attachments come and go. They can, they do, but that attachment is forever. That is something you will never lose or leave. But as a whole subject line, I think it was Johann Hari also who said the opposite of addiction is connection.
Yes.
So every one of my clients, I don't think there's an exception, Julie. There is an attachment component
Mm.
to their chosen behavior, whether they didn't fit in from the very beginning, there was a lack of attunement within their own family, they couldn't make connections on the outside easily. Social anxiety is something to deal with in almost every one of those clients. That's all about attachment and connection.
Yeah.
So there's science behind this, there's research behind it. There's a couple of good books. Philip Flores wrote one, I think, in 2004 called Addiction as an Attachment Disorder.
Hmm.
The other one was written later and whose name I can't remember. There's becoming really good research about the connections between
Mm.
attachment, connection, and
Yeah.
addiction. I
Yeah,
mean,
we know that it's not one single thing that causes addiction because if it was just genetics, every
well,
single person who had alcoholism or, issues with drugs or alcohol or behavioral addictions would have come from a family where that happened all the time. And
that
that
was
isn't true.
that was debunked a long time ago.
Right.
Yeah.
Right.
I'm sure that I will be long gone when new information about all of this is going to come up, and I'll be sad to miss it.
Oh, but you
But
won't know what you're missing. So
uh,
you won't mind so much. You'll be
I
off
guess
having great fun someplace else.
maybe.
Special thanks to Susan Brown again for this second part of the conversation. We'll have a third part of the conversation on our next episode of the EMDR Maven. Thanks again for listening, and until next time, take care.